We're back with Jeannie, and we want to take a little bit of a different look at the sensorimotor agility exercises now. And we know that we're coming back, we're looking at rigidity, bradykkinesias, and freezing, and we can utilize these theories to achieve improvements here. The theories all come down to the exercise principles: trunk rotation, reciprocal movements, rhythmic movements, having an erect alignment, and increasing making the movements large, as well as increasing the arm swing, right, and weight shifting as well. So boxing is an excellent task if you look at it the right way. Now, boxing from a neuroplasticity standpoint is salient, it's rewarding, and it's fun, and it's enjoyable. It helps to increase that dopamine system in that capacity. But from the sensorimotor agility exercises, think about the rotation that we can achieve, the reciprocal movements, the rhythmic movements. So often the first thing you may start with is helping somebody get set up in a boxer's stance. Now the stance is important because having that one leg forward and the other leg back and out to the side already opens up your trunk. It opens up your pelvis and it counteracts that closing down that Parkinson's wants to do to somebody. So we open up here, and then with every movement now, Jeannie here will have to rotate in order to reach my arm. So what I do in the beginning is just initiate with some gentle rotation. So let's start with the right, just a nice tap, and the left. And we'll tap, and we'll tap. Okay? And if you lose balance, just step back, get back in that stance, and get comfortable. All right? So now we can see the rotation, and what I'm going to do is I'm going to increase the rotation. I'm going to increase the reach to bring through more of these theories. So go ahead and bring that all the way out here, and then tap with the left, and bring it all the way out, and tap, and out, and tap, and out, and tap, and out, and tap. And we're increasing the rhythm of the motion as well. So we're getting the rotation along with the reaching, the big movements, the purposeful movements, and we get a little bit of a beat to it, which makes it a little bit more fun and definitely more easy to follow. Okay? Now, once that is understood and achieved, we've already dominated a lot of these systems, but now we can take it a step further and we can come into functional activity. So we increase the rotation, we add dual tasking by walking. That's our functional activity. Now this is a little bit more risky, so if the individual has any risk of falls, we should not be doing this, or you should have somebody guarding them. But in our case, Jeannie here got a perfect score on our assessments, and we know that her balance is doing very well, so we can safely attempt this activity. So we're going to start by just doing a rhythmic right and left cross. Just back and forth, right, left, left. And then I'm going to tell Jeannie just to follow me, keep up with me. And I'm going to walk in a little bit of a circle. And in this capacity, you could see the amount of rotation that's occurring. And obviously, it's a salient behavior. I think it's a little rewarding. And what we might do is turn, keep it coming, keep it coming, and pause. And change it up a little and have her do right and then tap with the left twice. Right, tap twice. Right, tap twice. Right, tap twice. Right, tap twice. And then back to the walk. And what this is going to do is now adds that variability into it. So we're increasing all of the activity. There we go. We're increasing all of that activity while combining all the theories we've discussed. So really we're bringing everything together into a truly functional activity, and ultimately a fun activity as well.